So SARMs we have discussed in detail. Now, then last topic we can say is oral contraceptives. First of all, how oral contraceptives work? If you see, this is uterus, this is fallopian tube, this is fimbria of the fallopian tube. Here ovary is present. Ovary contains ovarian follicle, which contains our heroine, which is ovum. So now pregnancy occur when sperm and ovum meet. So that means sperm and ovum, hero and heroine has to meet. The first process is ovum comes outside in the fallopian tube. This is called ovulation. It requires LH surge, sudden increase in LH. Then with the help of movement of fallopian tubes, it reach the meeting point here. Ovum reach the meeting point. Then the sperm is coming from the uterine side. So sperm, it is coming from the uterine side. After copulation, it comes here. So through the cervical mucus, it will penetrate and reach here. So sperm and ovum meet, they will form a zygote, and that zygote is implanted in the uterus where the pregnancy will proceed. So oral contraceptive inhibit these processes. So what are the mechanisms of oral contraceptives? Oral contraceptive, they can inhibit first ovulation. If ovum do not come outside, it cannot cause pregnancy. So they inhibit the ovulation. That means they inhibit LH surge. Second, they decrease the movement of fallopian tubes. Third, they can inhibit the penetration of sperm through the cervical mucus, because make the cervical mucus thick and hostile. And lastly, they can remove the implant because dislodging of the implant. So four main mechanisms of oral contraceptives. So oral contraceptives, we can use a combined oral contraceptive, that means estrogen plus progesterone, or we can use progesterone only pills, which are called mini pills, which contains only levonorgestrel. Okay? Then the special thing to remember are emergency contraceptives. So these are called as post-coital pills or morning after pills. So they are used after the unprotected intercourse to prevent pregnancy. So most of them should be used within 72 hours. So the drug which we can use are number one, combined oral contraceptive, that means estrogen plus progesterone. They should be given within 72 hours. So usually we give 2 tablets together. Then after 12 hours, we give 2 more tablets. Then second we can use is progesterone only pill, that means only levonorgestrel, again within 72 hours. And third we can use is mifepristone, which is selective progesterone receptor modulator. So all these are indicated within 72 hours of unprotected intercourse. Now if a female comes later after 72 hours, then up to 5 days we can use another drug called as Ulipristal as a single dose of 30 milligram. Ulipristal 30 milligram single dose can be used for emergency contraception, and usually no drug is indicated after 5 days, but sometime we can use IUCD, we can implant IUCD, although they also should be used early, but sometime we can use IUCD for preventing the conception after 5 days. Then coming to polycystic ovarian disease, a female with PCOD usually has unregulated cycle. So that means there is excessive bleeding. So to control that, drug of choice are oral contraceptive pills. So these are used to control bleeding. That if they ask what is drug of choice for PCOD, answer is OCP. Then second, most of these females have insulin resistance. So we want to prevent that. So that is done by metformin. Metformin is used for insulin resistance. Now, if this female require pregnancy, so we want to induce ovulation, and the drug of choice for inducing ovulation are aromatase inhibitor called as Letrozole. And previously we were using clomiphene. Now we are using Letrozole for inducing the ovulation. Okay, so these are important points regarding the PCOD.